Just coming back from ASH, clonal hematopoiesis or CHIP is becoming increasingly important. It's becoming increasingly important because, with multiple myeloma, we've always seen history of second cancers. I think there's renewed interest in that, given that with cellular therapies, we're seeing a slightly increased incidence of hematologic cancers. So what we ended up doing is sought to look at clonal hematopoiesis in our patients with multiple myeloma. We generally do a heme panel or a gene panel, which has been done on all our patients. It looks at a little over 100 genes, and there are specific genes which you can call out when you want to identify clonal hematopoiesis. And when we looked at that, we wanted to look at whether or not having clonal hematopoiesis impacts the outcomes of these patients. Now, the incidence of clonal hematopoiesis is not that uncommon. What we found was that older adults had a higher incidence of clonal hematopoiesis or CHIP, and that is not uncommon. But what we didn't see was it impacting the outcomes. We did see a couple of people with second cancers or MDS leukemia in this patient population. Again, our cohort of patients is much smaller. Of those patients, not all of them had a CHIP sequence to begin with. There were two of them who had the incidence of CHIP. So again, numbers are small, but sufficely to say that CHIP may be a marker which we should be following in the future. I think looking at larger studies is going to be helpful, but the bottom line right now is at least it does not necessarily impact myeloma survival. CHIP is associated with other diseases, cardiac diseases and so on and so forth. So there's a lot of other factors which may be contributing to the impact of CHIP as well.